Good morning. So I might initially go through some of the geography of the cases reported in the last 24 hours. In the north, we had new cases in local government areas including 240 in Hume, 102 in Whittlesea, 63 in Moreland, and 28 in Darebin. We also had 31 new cases reported from the Melbourne City Council area. In the west, we had new cases in local government areas including 55 in Melton, 54 in Wyndham, 63 in Brimbank, 29 in Moonee Valley, and 22 in Maribyrnong. In the southeast, we had new cases in local government areas which included 50 in Casey, 14 in Cardinia, 18 in Port Phillip, 16 in Greater Dandenong, 10 in Stonington. And in the east, we had new cases in local government areas including 15 in Manningham and 6 in Boroondara. When we turn to regional Victoria, we had 30 new cases across Victoria's regions yesterday, which brings us to a total of 225 active cases in the regions. There were 9 in Mitchell Shire, 4 cases in Warrnambool, all from the same household, 2 cases reported from Greater Dandenong, 2 cases in Moorabool, 2 cases in Wellington, and 1 case each in Strathbogie, Surf Coast, Ballarat, Murrindindi, Corangamite, Baw Baw Shire, and South Gippsland. And as we indicated in a media release last night, we had 4 new cases across 2 households in Latrobe City, which added to the existing cases in that outbreak that Minister Foley was referring to. With respect to vaccination, we know from both modelling and from the experience in New South Wales that our case numbers will continue to climb, but it is absolutely within our power to slow the spread and to prevent thousands of cases and hundreds of people from becoming seriously ill and some people losing their lives. And we can do that by following the public health directions, social distancing, and of course, getting vaccinated. Vaccinations remain our best weapon to fight back against this deadly virus. And just in case we needed to sort of reiterate some of the data that underpins these recommendations, since the 12th of July, over both the current and the previous lockdown periods, there have been a total of 15,238 cases of COVID-19. And of those 15,000 odd individuals who are diagnosed with COVID, 79% were eligible at the time of their infection and diagnosis, but 88% of the cases were unvaccinated. Similarly, 86% of hospitalised cases were unvaccinated, and 98% of individuals admitted to our intensive care units with COVID-19 were unvaccinated, 98%. So these are the sort of data that show how powerful all these vaccines are against preventing infection and especially preventing serious illness, ending up in hospital and losing your life. The AstraZeneca vaccine, the Pfizer vaccine, and the Moderna vaccine, all incredibly effective, 90% plus at preventing those serious outcomes. In the next 7 days, in the state system, we have 7,700 Pfizer appointments available and 8,100 AstraZeneca first dose appointments available. And our primary care providers now have double the vaccine allocation that the state system does. So if you haven't already, please, now is the time to book your first dose and join the millions of Victorians in fighting back against this virus.